Vascular tumors, von Hippel-Lindau disease, retinal capillary hemangioblastoma. Retinal capillary hemangioblastoma are benign vascular tumors diagnosed as a part of von Hippel-Lindau disease. 3 elements and 3 combinations for diagnosis of von Hippel-Lindau disease: cerebellar or retinal hemangioblastoma, visceral lesions, renal tumors, pancreatic cyst or tumors, pheochromocytoma. Positive family history. Von Hippel-Lindau disease is a multisystem autosomal dominant disorder with age-dependent penetrance. VHL is a lifelong diagnosis. Majority manifest by 10 to 60 years. 95% penetrance by age of 60 years. Chromosome 3, tumor suppressor gene. Prevalence of 1 to 35,000 to 1 to 40,000. Screening of elderly family members is important in diagnosis. Incidence of manifestations in VHL. Retinal angiomas. Frequency 60%. Mean age of onset 25 years and the range is 4 to 68. Cerebellar hemangioblastomas. 60% in frequency. 30 years is the mean age of onset and the range 13 to 61. Renal cell carcinoma. 30% frequency. 45 years mean age of onset and 23 to 68 is the range. Spinal cord hemangioblastoma. Frequency 15%. Mean age of onset 35 years and the range 11 to 60. Pheochromocytomas. Frequency 10%. Mean age of onset 20 years. Range 12 to 58. Gross picture. Retinal hemangioblastomas. Most frequent manifestation 45 to 60%. Earliest manifestation mean age 25 years. 95% after age of 10 years. About 50% of cases are bilateral. Hemangioblastomas are dilatation of capillaries. CNS hemangioblastomas. 3 major sites: cerebellum, spine, and medulla. Age 30 years, range 11 to 78 years. Only 5 to 30% are due to von Hippel-Lindau disease. Younger age and multiple sites, von Hippel-Lindau. Solitary hemangioblastoma can be an initial presentation for VHL. Gross picture of von Hippel-Lindau disease also includes renal cysts, renal cell carcinoma with mean age 37 years, adrenal tumors, pancreatic cystic disease, pancreatic islet cells tumors, papillary cystadenoma of the epididymis, and endolymphatic sac tumors. Systemic investigations: imaging, CT with contrast, MRI and MRA, ultrasonography. Laboratory: vinyl mandelic acid in urine. Genetic testing: mutations in the 3p25 gene. Prognosis: causes of death in von Hippel-Lindau disease: renal cell carcinoma and cerebellar hemangioblastoma. Average survivor rate of 49 years. Follow-up protocol for von Hippel-Lindau disease. At conception, inform obstetrician. At birth, inform pediatrician. At the age of 2 to 10 years, we undergo an annual follow-up with physical, neurological, and eye examination for nystagmus, squint, or white pupil. At the age of 11 to 19 years, the follow-up protocol is as follows: every 6 months, retinal examination. Annually, physical, neurological examination and detection of VMA. Every 2 years, MRI brain and spinal cord. At the age of 20 and beyond, annually, we undergo retinal, physical, and neurological examination and VMA in urine. Every 2 years, MRI brain and spinal cord. Retinal cavernous hemangioma. Clustered dark intraretinal venous aneurysm. Along the course of a vein, on the optic nerve, associated fibrosis is present. There is no feeding artery, no yellow exudates, and vitreous hemorrhage is present. Fluorescein angiography. Arterial phase, hypofluorescent vascular channels. Venous, mild hyperfluorescence. Late venous, more hyperfluorescence and no leak. Late fluorescein blood interface.